Welcome to the session on gender and health as a part of gender sensitization session. In this session, we will be learning about the basics about the health, gender, well-being, quality of life and various related aspects related to health and gender. If we see the World Health Organization in 1946 envisaged that health is a fundamental right of every human being. Understanding health as a human right creates a legal obligation on the states to ensure access to timely, accessible, affordable health care of appropriate quality and well-being of the people of their state. Health is a vital component of human development, and human development have impact on economic and social development of any country. Even in India, Article 21 of the Constitution guarantees a fundamental right to life and personal liberty. Right to a health is inherited to a life and dignity. Health is a state subject in India. That's why if you see in any crisis, central government gives the guidelines and the state government implements all the guidelines using their resources and as per their policies, but within the national health policy and the guidelines provided by the center. Health definition by WHO. In 1948 and 49, WHO defined health is a state of physical, mental, social well-being and not merely the absence of disease or infirmity. But later on, they added the word with these three terms, that is, health is a state of complete physical, mental, social and spiritual well-being and not merely the absence of disease and infirmity. This is consistent with the biopsychosocial model of health. The model considered physiological, psychological, social factors in health and illness and interaction between these factors. If you see in this diagram, all these factors are shown by different colored circles and their associated factors, and in between all these three factors are interacting and the health has an impact on it. They have shown the example of mental health. Concept of health. There are four conceptual models of health, that is behavioral, ecological, psychosocial and holistic. Let me explain you all these four. Biomedical. As the term says, there is some agent, a virus, bacteria or any organism that causes the disease. In case there is no organism, there is absence of disease. Ecological, there is an equilibrium between man, environment and disease. Man, that means the agent, host and environment. Agent, there is a disease agent is there, host is the man and its environment. If there is an equilibrium and no interaction, then there will be no disease. But if there is an interaction between agent, host and environment, there will be disease. Psychosocial, that means influence of social, psychological, economic and political factors. Holistic, as the term says, all the above factors, but dominance is of social, political, economic and environmental factors is there. Spectrum of health. Health of an individual is not static. It is dynamic and a process of continuous change. Health and disease lie in a continuum. If you see on your right side, I have shown you the spectrum, that is freedom from sickness, better health and positive health in the positive side. Negative side, There is unrecognizable disease, mild sickness, severe sickness, and extreme case, the death. The extreme cases, positive health and the death are rare. Most of the time in our daily life, the health of an individual fluctuates between feeling wellness and freedom of disease, or from the mild disease to the severe disease. Then concept of well-being. There is an objective and the subjective components. Objective component means standard of living. Standard of living in terms depends upon the scale of expenditure, goods consumed, and the services the person or the family enjoys. The income of the family, occupation, housing, sanitation, nutrition, provision of health services, education services, etc. Then the subjective component is the quality of life. Quality of life measures the physical, mental, social well-being as perceived by each individual or group of individuals. That means subjective feeling of happiness, satisfaction, life concerns, they are happy in their married life, in the family, with the work. So all these factors are part of the well-being of a person. The WHO definition links health explicitly with the well-being and conceptualization of health as a human right requiring physical and social resources to achieve and maintain health. Well-being refers to a positive rather than neutral state. Subjective well-being varies greatly between individual and to the factors that contribute to the well-being of a person. Wellbeing Institute of University of Cambridge, which defines well-being as positive and sustainable characteristics which enable individuals and organisms to thrive and flourish. What they did, they have taken all the common themes from various definitions, and in simple terms they said feeling good and functioning well is a part of well-being, or in the simple terms, a person who feels good and functions well in day-to-day life is having a well-being, healthy life. Objective well-being measures that is self-reporting. We as a health personals ask the people how they feel about their health, how are they feeling. The subjective measures can be that how did you sleep at night? How are you feeling today? Or have you taken adequate food? What about the physical health, education facilities and the safety? And in the technical terms, when they see morbidity data and the life expectancy, they associate with the history taken from the patients. Mortality is day-to-day diseases diagnosis is being done, that is known as the mortality data, and life expectancy at birth is how long the person will survive as a human being. Then subjective well-being, it is the personal perception of that certain individual. That is, are they happy? Are their emotions positive? What is their life meaningful, or they are under stress, or they are having negative emotions, not good relations with the people. So how a particular person is feeling about their own self, that is a basic concept of subjective well-being. Relation between physical and mental health. There is a association between physical, mental well-being of a person. Various studies have shown the medical conditions like stress and asthma causes impact on the mental and the physical health also, and various other studies have also shown if there is a stronger immune functions due to association of good social support of a person with the family or from the society. Like in the cancer patient, the immune system is very weak, but if they have a strong social support from their family and the friends, they can survive long. They can respond to the treatment what they are getting. It is clear from that studies that physical health has an impact on the mental health, and mental health vice versa has an impact on the physical health. Behavioral and social risk factors and physical and mental health problems they always overlap. It's very difficult to determine whether the illness is due to physical factors or due to the mental factors, or both have the impact. But studies have shown both have impact on each other. Quality of life. Quality of life is one of the very important factor which have various domains, that is to type of facilities the person is availing in their life, the type of services, the type of job, the type of housing the person is living, schooling, neighborhood, aspects of culture and norms, spirituality, all these domains have an impact on the quality of life. Like I will give you example. Some of the people, when they come to the hospital from the rural areas, they have their own culture and values and spiritual well-being. But in the urban hospitals, the health workers think these people do not have any understanding about the disease, and they are not understanding what are they asking. Suppose they are taking history, there is a female patient, a male doctors are there. The cultural values in the villages are, in most of the villages still it's very prominent that female will not speak to the male person openly. So we are not understanding from which culture values the person has come. Sometimes they have their own beliefs, but it's very difficult for the health professional to understand why they are having these beliefs. We say they have taboos, they have superstitions, but they have their own spiritual beliefs to do certain things and believe in the treatment. Health related quality of life. Health related quality of life has an impact on physical and mental health, mood of a person, then health risk conditions, then the functional status, social support, socioeconomic status. At community level, what are the facilities provided, what are the practices prevalent in the community, have influence on the population's health, perceptions and the functional status of the people. Like already I have told you, certain communities have their own cultural values, tradition, norms and values, which may have a positive or a negative impact on the individual's health. Same way, the individuals, the physical and the mental health have the perception about their health, what they perceive about their health. Health is important for them, in what type of housing conditions they are living, what are the health risk factors in that society or in the family. All these have impact on the quality of life, and the health risks are associated with that. Life course perspective. This is a very important thing to understand. Whenever you must have gone to hospital or you must have seen someone going to the hospital, the doctors, nurses, they ask the history, the past history, the present history, and the family history. What type of diseases the family had, the parents, grandparents, any medical history of the same particular person. Why they want to ask this? Sometimes the patients are not able to understand, because the person who had diseases during early childhood, during adolescence, in the young age, has an impact of all these in the aging or the elderly age when they have these chronic diseases. If the immunization status of a child is not complete, the child may have some problems in the adolescence age group or the young age group, which again will have impact on the elderly when the person becomes 60 plus. Same with the women, a girl child. Suppose the girl child is not able to get the proper care when she was born and not accepted by the family. She may have some physical or emotional problems, which again will have impact on the childhood, on his adolescence, and again when she becomes mother, when she is lactating, when she is antenatal or taking care of child, or when she get married, a young girl in teen age she gets married, she may have impact on her health. If she has early marriage, early pregnancy, she may have impact in the older age group. So life course perspective is studying person, family from the childhood till the later age, because it has impact on quality of life and the health and disease pattern. Social determinants of health. Social determinants of health are the non-medical factors that influence the health of the person, like where person was born, where he grew up, worked, age factor, and the wider set of forces and the system shaping the conditions of the daily life. Because all these factors, the economic policy systems, developmental agendas, social norms, social policies and political system has an impact on the health of a system. If you see, already I have told, health is a state issue. If any state do not have a good socio-economic policies or the health policies are not implemented properly, the social norms and policies do not have impact on the positive health of a person. Political decisions taken by the local political leaders, how much investment to be done in the social sector, education, health, social welfare of the people, social welfare of the vulnerable group, women, girl, elderly or other vulnerable groups, it all will have impact on the health of a person. So the social determinants of health also play very important role on the quality of the life, quality of health and quality of health services a person is getting. Gender. Gender refers to the characteristics of women, men, girl and boys that have socially constructed. That includes norms, behaviors, roles associated with being a woman, man, girl and a boy, as well as their relationships with each other. As a social context, gender varies from society to society and can change over time. If you see, many societies give too much importance or inheritance to women. But mostly in our country, all over the world, even in various countries, it's patriarchal family. But in many states, you must have seen, when the girl is born, family is very happy. Because they know girl is being important for their family. Even afterwards, she will inherit the property of the family. The health services should be affordable, accessible, acceptable to all, and they should be provided with quality, equity and dignity. Gender inequalities, discrimination faced by women and girls put the health and well-being at risk. Women and girls often face greater barriers than the men to health information and health services. Some of the barriers, if you see, been highlighted, they are restrictions to mobility, lack of decision-making powers, lower literacy rate, discriminatory attitude of the community and the healthcare workers, lack of training and awareness among the health workers to the problems and the health systems of the specific health needs and challenges of women and girls. It's very common in various families when women get sick, she has no power to take decision when she will take treatment, where she will go and who will accompany her, from where she will get money. She cannot even decide what diet she has to take. Even after pregnancy, you must have seen, women has to follow all the family norms and the customs unless the sister-in-law or mother-in-law permits her to eat something or perform certain rituals. She is not allowed to even feed the baby. There are women, when they are sick, even during pregnancy, families think it is a normal process. Every pregnant woman have these problems. It's not unique for this particular women. Teenage pregnancies, rapes. Some societies think these are very common. They accept it. But again, they are all have the impact on the health of a girl and a woman. A girl child, when she is born, if she is accepted in a family, she will have a good mental health and physical health. She will get good food, she will get good education, and she will be supported by the family members. But suppose the girl child is born, she is not being supported by the family, she is not taken care of, she is not being educated. She will at risk of physical and mental health diseases. I will share one example with you. In one of the hospital, a mother have given birth to the fourth girl. She was the fourth in sequence. Naturally, mother was very unhappy because she was afraid that my family would not accept the girl child. But the medical superintendent of that hospital, when he came to know she has delivered a girl, he planned something for that mother and the girl. He invited the family members, grandparents, uncle and aunt of that girl, and some of the health staff who has delivered that girl, doctors and nurses. He appreciated the family and the mother that this girl, and given a certificate to this girl that this girl till lifelong will get free services from that hospital on priority basis. And she was given rupees 5,000 in her account so that every month the parents can invest some money on her behalf. So this girl brought a pride for the family, priority treatment for her family, and in that way she was accepted by the family. So you can see what are the social, individual, cultural factors that can actually change the life of a girl child even. The gender and access to health services have the impact on the status of the women's life. Harmful practices like female genital mutilations, early child marriage, forced marriage, malnutrition, cervical cancer, these have impact on the women life from the childhood till she become mother and in the older age. Cervical and the breast cancer is very common because hardly women are taken for the screening because they feel they do not need that much type of care. These are some of the examples of the gender norms and the rules that has impact on the women's health. Women are responsible for child care, and in case the parents or the father is associated with the health care of the mother or of the child, it will have a positive impact on the child care. But most of the time during the prenatal and the antenatal, that is during when the mother conceives and during the pregnancy, father hardly play any role. It has negative impact on the mother because sometimes mother is not able to go for the services or have psychological factors. But nowadays it is being made mandatory that Father is also been given a training of the child rearing and paternity leave, and father is involved for the child care. So at the end we can say, although women and men differs in terms of their power, status, biological makeup and the social responsibilities, but unless the policies, programs, plans are made keeping in mind what are the societal factors, customs, norms, physical factors, barriers, needs of the women and girls especially, the outcome of the services and plan will not be effective. Gender has an impact on the health of the women and the girls and vulnerable group, and health services has, if not accessible, not affordable, not utilized properly, will have impact on the health of the women and girl. So you can see there is an impact and association between gender and health. This was the basic concepts which we have learned today. In broader concepts and their broader applications and the impacts we will have in the later other sessions, where you will see how these impact the life of a woman and girl. Thank you so much.